This is Late Night Health. This is the radio show that cares about the most important part of your life, your health. During the next 2 hours, we're going to spend some time looking at various aspects of health as they figure into each and every one of our lives, ranging from integrated care for people of all ages, and we're also going to be spending some time this hour, I'm excited about it, with talking about PTSD, post-traumatic stress syndrome or disorder, and we're going to be talking about some vets, combat vets who are currently climbing Mount Everest. We'll be talking to the ground crew and the co-founder of this nonprofit organization designed to bring attention to PTSD. During hour 2, we're going to spend some time with Janet Richmond. She's written a book called Soul Psychology, and we'll be talking about that. And we're going to end up with our friend Molly, and we're going to be talking about an upcoming event called the SOAR event. It's absolutely wonderful. If you watch our Facebook and tweet feeds, last week I tweeted about it, and I thought, we ought to talk about it, because even though it's happening in the Washington, D.C. area, it's going to be something that everybody can learn from. And as SOAR expands not only nationally but globally, we'll be involved with them and help them along the way. All right, we go, as a matter of fact, to the Washington, D.C. area, Virginia to be exact, and we speak with Mara Benner, and she is with 4 Directions Wellness. You're the CEO of 4 Directions, are you not, Mara?
I am, Mark, and thank you very much. I'm so excited to be with you, and I congratulate you for the Late Night Health and all of the integrative care that you're looking at within the show and getting this out. It's fantastic, so thank you so much.
You're welcome. What is integrative healthcare, and why don't we have more of it?
That's such a great question. So I am a big proponent of integrative healthcare, because really when you look at the physical health of someone, it is so much more than just their physical health. It has to also be that we look at the whole person, meaning that we're looking at their mental thoughts, their emotions, and also just kind of considering what passions they have. So it's something that is becoming more and more in the mainstream, and I think that's a positive thing. There is sometimes some confusion with exactly what is meant by integrative healthcare, because it goes by so many different names. It's called integrative healthcare. It might be called complementary and alternative medicine. It also is sometimes called functional medicine. So there are often so many different names that's sometimes the confusing part of exactly what it is.
And it could be also mind, body, spirit.
Yep, absolutely. And actually, 4 Directions Wellness is actually named because I am interested in connecting the body, mind, emotions, and spirit.
How important is the spirit? And we talk about diseases. We're going to be talking about, as I said, post-traumatic stress a little bit later on. We're going to be talking about how to get your life together with our friend Molly later in the show. How does spirit work into this equation, if you will?
So spirit to me actually means, what are you as an individual most passionate about? And so it's really connecting in with someone about what it is that they get their excitement from. And sometimes we don't like to use the word soul, but really it's about what makes your soul happy. So it's really pursuing the passions that they have, the sense of life purpose, and what it is that makes it most meaningful for them. And in order to help a person kind of connect back into what is making their soul and their spirit soar, you have to kind of figure out how to help them tap into that. And much of that is around mindfulness techniques, whether it's guided imagery, meditation, and even things such as Qigong, which is a Chinese movement technique. all of these various ways might help that person kind of reconnect into what they're most passionate about. It can even be as easy as them wanting to take a walk through nature, or sometimes it's exercise. And
by them, do you mean people who are, say, over 50, over 60, or is it anybody?
It's everyone. It's helping children to understand what they're most passionate about, but it's also helping individuals who maybe have gotten a little disconnected because they've gotten into the same job or the same relationship, and they just need a chance to take a break and to kind of reconnect in to see what it is that excites them the most.
Your experience has been in administrative policy more than hands-on patient-to-patient. Can you explain that?
Absolutely. So I actually was someone who really enjoyed working with seniors since I was very young. My grandmother was in a nursing home, and I went to go see her every day and just fell in love with being with seniors who had such great wisdom and learning from them.
That's why you like hanging around with Daryl and me. Okay, get it. We get it. Okay, good.
And I'm actually getting older myself, so it's all there.
Then, in that case, the three of us need to find somebody younger to take care of us.
Right, absolutely. Right. I'm counting on my grandkids to do that.
Right.
But, so I majored in gerontology and started to really work in hospitals, nursing homes, home health, hospice, so a whole variety of healthcare settings. And I wound up here in D.C., worked on the Hill for a congressman who at that time was on the Select Committee on Aging, which is no longer around, but really got into policy. And what fascinated me was taking a look at our current healthcare system, which is very good. We've got great people out there. But at the same point, we're facing some changes, and we've got an aging population that's growing that we're trying to figure out what to do with. And as policymakers began to really delve into some of the issues that we're facing as a country, and one of them you and I talked about, Mark, which is that our life expectancy in the United States is really lower than other countries that have some wealth to them as well. So because we're a wealthy nation, you would expect us to have longer life expectancy.
Only if you have a lot of money, apparently.
Yes, and that is a concern.
It is a concern. Let's talk about something that we also talked about. The U.S. is ranked number one in spending, in per capita spending on health care. Yep. That's per person. But at the same time, the quality of that health care is number 37.
Yeah.
That's sad.
Very sad. And a wake-up call for us. And this is part of the reason that integrative care is starting to be looked at. But to go back to your example, there was a great study that was done, I believe, in 2009 by Dartmouth Atlas. And what it said was basically when they looked at the United States, you could tell that there was a lot more spending taking place in certain cities across the United States, and especially the larger metropolitan areas. So a lot on the East Coast, Boston, Massachusetts, New York, the Baltimore, Washington region, some in Texas, and a little bit over on the West Coast as well. So lots of spending in these metropolitan areas. But when they looked at quality, the quality was drastically reduced. And what was fascinating to them was in Portland, Oregon, where the spending was much less, they found excellent quality.
Interesting. That really is a very interesting statistic.
Yeah. So policymakers were thinking, okay, what do we need to learn from this? And they begin to look at some of the key factors that go to play on this. And a lot of it is the fact that we, first of all, have the Medicare and Medicaid program. So Medicare, as you know, is federally done, and it is for our seniors. And Medicaid is a federal-state partnership, but it's for those with low income who need health care. And what they started to look at, and these are, of course, our biggest health care dollars go to Medicare and Medicaid, is the fact that, there's some issues with that. There's a lot of providers who are working with different patients, but don't see that patient all the way through as they're experiencing some sort of a healthcare issue.
But at the same time, they don't try different things. They don't use that integrative approach that we were discussing.
Right.
Right? And I think that's, not only can it help the patient, my feeling is it would be beneficial to the bottom line and save money. That's
exactly it. And so what's fascinating to me is, let's say you go to see your physician, your primary care doctor. When you walk in the door, you may be there either for a wellness check or for something that's happening physically for you.
Right.
But very rarely do you have your primary care doctor who does a complete assessment of you. And I'd even ask this of you, have you had your primary care physician ask you recently if you've been through a major life transition or the loss of a loved one?
No, and actually not. But he has told me that I'm 3 years overdue for a physical. So I guess I have to take care of that. Our guest is Mara Venner, and she is the CEO of Four Directions Wellness. We're going to find out what Four Directions Wellness is designed to do when we come back, so that we can find out how you can learn, how all of us can learn from Mara, from her 30 years of experience, and now some hands-on, one-on-one as well, experience in helping people of all ages get better, faster, quicker, and cheaper. I'm Mark Alyn. This is Late Night Health. Join us at latenighthealth.com. Lots of information there. Mara and I will be back along with the Insane One. Don't go away.